Okie doke, we might get started. Good evening, everyone. And thank you so much for joining us tonight for this very exciting event. Brisbane North PHN is presenting a What's Next for Primary Sense using Primary Sense for MyMedicare patient registration. My name is Claudia Savage, and I am the project lead for the Primary Sense transition here at Brisbane North. The purpose of this webinar is to help inform, educate, and support general practices in our region to use Primary Sense for MyMedicare, specifically to identify your patients through the voluntary patient registration report, which we'll be highlighting tonight, and understanding that the tool is in its infancy. We want to help integrate Primary Sense into your daily practice and not to be an extra item on your to-do list, because we all know we've got a lot of those already. Before we get started, I'd like to offer an acknowledgement. We'd like to acknowledge the traditional custodians of the lands in which we are meeting today. Bearing in mind, we do cover quite a large region in Brisbane North. We'd like to acknowledge the waterways, the land, the sky, and all of those who inhabit this place. We acknowledge their ancestors, the elders, and recognise those who continue to protect and promote Aboriginal and Torres Strait Islander culture. We acknowledge the past and we stand together for our future. So before we get started, I'd like to go through a few points for housekeeping. We'll have time at the end of the webinar to answer your questions. So please, if you do have any questions, add them into the Q&A section and we can answer them at the end. If they do not get answered due to time constraints or we are not able to answer them, we will be sending out a FAQ resource in which we'll get all the answers and we'll send that to you out in your pack after this webinar. Tonight's webinar will go for 60 minutes and tonight is being recorded. It may be used as a training resource for practices within our region, and furthermore, those who are not able to attend will be able to access the recording. Once this webinar has finished, an evaluation will appear on your screen to provide some feedback. And we really do welcome your feedback so we can help improve virtual training sessions or webinars like these. And lastly, our slides and any related resources, and as I mentioned, tonight's FAQ will be sent out in addition to your certificate of attendance, so you can log your CPD points. Please note that this may take up to 2 weeks to send out to you. So what are we going through tonight? We're going to go through an introduction and then we'll take a deep dive into MyMedicare, Primary Sense, having a look at the VPR, the Voluntary Patient Registration Report, how you can turn MyMedicare into a CQI activity. We'll go through our Q&A and then we'll conclude the webinar. So before we get started, I'd like to introduce you to the team. On the left, as you can see, you've got myself there. As I said, I'm Claudia and I'm the Primary Sense Transition Coordinator here at Brisbane North PHN. And then we have Alison Leach, who is our Quality Improvement and Reform Lead. Furthermore, Alison is coordinating all things MyMedicare. And then in the middle, we have Jolynn Harding, and she is the Primary Care Team Leader for the engagement side of the team. And then on the right, we have our lovely Quality Improvement and Development Engagement Officers. And these team members currently support CQI and development for Primary Sense training. And tonight we have joining me Leanne, Tammy, Joe, and Alison. And now I'd like to hand over to Alison, who's going to discuss with you all things MyMedicare.
So much, Claudia, and welcome everybody this evening. So tonight I'm going to be speaking about MyMedicare, Unlocking the Benefits, a deeper dive into practice support for MyMedicare. First of all, a little bit of understanding as to what is MyMedicare, what it is. It is a system for voluntary patient registration, and it's designed to help strengthen the relationship between patients and their practice, their practitioner, and their primary care team. Now, it's also important to understand what it is not. It is not, despite what some people may be feeling, a new method of torture for GPs and practice staff. It is not patient restriction, so it is voluntary. It is voluntary for patients to register, and it's voluntary for practices and GPs to participate. Once a patient registers, they are still able to go and see other practitioners in other offices and also other GPs within the practice that they choose. And they can still access their MBS items just as they do now. But there will be certain items that new incentives that will be linked to those that are registered for MyMedicare and practices and GPs that are registered. It is not NHS and it is not capitation. So capitation is typically where a practice is paid based on the number of patients that they have registered to a practice. And that is not the case with MyMedicare. All the MBS item numbers that are available now will still be available, but there will be some new ones added that are linked to those who are registered for MyMedicare. What do practices need to have in order to register for MyMedicare? They need to provide Medicare funded services. They need to be registered on PROTA, HPOS, and the organization register. And that's something that at the PHN we can assist with, helping practices to register and get set up. They need to have at least one provider linked to the organization register. And they need to be an accredited practice. And practices have 12 months in order to achieve this. So you can register now and over the next 12 months work on your accreditation. And again, that is something else that here at the PHN we can assist you with if you are interested in getting accredited. Some mobile and outreach practices are exempt from this accreditation requirement until the 30th of June 2025. And that really applies to some residential aged care facilities, services that are providing care to homeless, First Nations community, and there's some other exemptions in there as well. So what do patients need to have in order to be eligible to register? Patients need to have had 2 face-to-face visits with a practice in the previous 12 months. Now, there are some reduced requirements for those in MM6 and 7 locations, so more rural locations. And also children of a registered parent. So if a parent attends a practice and has had those 2 face-to-face visits, then the child is able to register as well with that practice and that GP without needing to have those 2 face-to-face visit requirements met. And those disadvantaged by family and domestic violence or homelessness are also exempt from that 2 face-to-face visit requirement. Patients can register at the practice or they can register online. And this is a 2-part process. So if a patient goes on to there's a couple ways that they can register or initiate the registration process. They can go on to their MBS app, or they can go to MBS online and they can register that way. And when they do that, the practice then needs to go into their PROTA account and accept that patient. So the patient can initiate and the practice can accept. And the practice has a month in order to do that once the patient initiates the registration process. Otherwise, the patient can complete the paperwork in the practice and the practice can initiate the registration process from their end. So patients and practice both need to agree that they want to have this relationship. Children and DVA card holders need to register at the practice only. So DVA card holders, because they do not have a Medicare card, need to go into the practice to register, and children as well. And children under 14 need a parent's consent in order to register. So So just looking at the MyMedicare timeline. So some of these dates have already come and passed. So practices now have the ability to register with PROTA, HPOS, and the organization register, and lots of the practices in our region have done so. As of the 1st of October, patients have been able to register to practices using a Medicare card or a DVA card. And starting this past November, there were new item numbers that were added for MBS level C and D telephone telehealth items. They were available for registered patients, and the triple bulk billing incentive for MBS level C, D, and E telehealth items became available for eligible patients only and their registered practice. So those are mainly longer telehealth and video sessions that, in order to qualify for those incentives, the practice and the patient needed to be registered for MyMedicare. And a lot of these incentives are geared towards providing care for those people with chronic and complex conditions. From the 1st of February next year, there's going to be a national public advertising campaign that will begin. So I really do encourage you, if you have not registered for MyMedicare, registered your practice, and started to go through the process of registering patients, I encourage you to do so, just to make sure you are all set up when the national public advertising campaign begins and patients start looking for you on their MBS app and trying to find you, or they may start coming into your practice and asking to register. So I encourage you to do that now and get some of those kinks out. As of the 1st of August, 2024, there will be some incentives for aged care will be available for practices and providers who regularly visit aged care homes. And there'll be some, I'll go into a little bit more detail further on about that. And as of the 1st of November, registered patients will be eligible for MBS chronic disease management plans only at the practice in which they are registered. And that's really designed to encourage people to get those chronic disease management plans with their usual GP in practice, rather than those plans being initiated at a practice that perhaps they've only attended once. I think it's also important to note that there will be new incentives to come. So this is really sort of the beginning of a larger structural change and different incentives that will be coming down the track. So what are some of the benefits for practices? Some of the benefits of MyMedicare for practices is that you'll be able to get a really true understanding of who your patients are. So by solidifying that relationship and having the patient register to a practice and choose their usual GP, it really does help you to gain that understanding of who looks at me as my clinician and my practice, and who perhaps just visits on occasion. It helps to embed the role of GPs in primary care into the whole system, and it helps to formalize that long-term doctor-patient relationship, which is really important when you're trying to treat chronic and complex health conditions effectively. It makes outreach more targeted. So once you know who your patient population is, if you're trying to institute some educational initiatives in your practice or some quality improvement initiatives, it really helps to gain that understanding of some of the concerns of your practice population. And it also helps to shift from an episodic care model to a more longitudinal, preventative, multidisciplinary, team-based model of care, which is what a lot of the initiatives will be linked to. So it does support practices to provide preventative care and early treatment. And it promotes having that established relationship with a nominated GP in practice for a seamless, integrated, and continuous care. So rather than having that patient that just sees sees you and then goes down the road and sees somebody else. And that really does affect that continuity, which we know is important for clinical outcomes. Reduces the fragmentation of care caused by multiple service providers, and also helps to fund those longer telehealth appointments, which benefit people with disabilities or mobility issues that find it difficult to get to face-to-face appointments. So I mentioned earlier that one of the incentives that will be coming is the General Practice Aged Care Incentive from August 2024. We don't have a lot of details on that yet, but what we do know is that the SIP will be replaced with a SIP-PIP combination, with 70% going to the GP and 30% going to the practice, just to encourage some of that team-based model of care, rewarding quality, continuity of care, and regular visits. The current $10,000 cap will also be removed. For the chronic disease management items, they will be linked to patient registration from November 2024. And some of the things that will be tied to that are, there will be a removal of the item 723. So simply having a care plan will then trigger eligibility for an EPC referral. There will be removal of some red tape, so that requirement for paperwork to be faxed back to the GP. And there will be a rebalancing of items 721 and 732 into items of equal value. So there will be a significant increase in 732 and a slight drop in 721. And again, that is just designed to help encourage that review process. So rather than the plans just being made at a practice and there's no practice to follow up, that will be encouraging that continuity of care with their usual provider. And then the hospital frequent hospital users incentive in 2024 to 2025 will be commencing with starting with just 9 PHN regions and rolling out nationally over 3 years. So as I mentioned earlier, this is an initial building block for some larger systemic changes. Now, how can we help you at the PHN to navigate this change? I encourage you to take note of our website. And I've just put that at the bottom of the slide. Visit our website, brisbanenorthphn.org.au, because there are a whole bunch of resources on there to assist you with this transition. And there are a number of ways that we can also help. So don't hesitate to reach out. There's some numbers on the website as well for places to call and how to contact us at Practice Support to get assistance with any or all of these things or questions that you have. So we can assist with registration with PROTA, HPOS, and the organization register. And we've had a number of practices who have reached out for that assistance, which has been great. We can assist with practice accreditation. And we can assist with practice preparation. So including data cleansing, going through your active patient list, trying to analyze and figure out how to allocate those to various GPs. And we will be discussing how to do that a little bit with Primary Sense and a little further on in this webinar. And we can also assist with quality improvement activities linked to your continuing professional development requirements. So if you're interested in doing an activity to gain some of those CPD points, we can assist you with that. And also by conducting webinars like tonight. And there's we did do another webinar last week on MyMedicare, and there's another one to come. All those recordings and recordings from RACGP are all on our website. So if you want to view any of those or show the rest of your practice team who maybe don't have that much of an understanding of MyMedicare, all those resources are located there. So some other things that are available on the website, some of the communications packages. So for instance, pamphlets and flyers to give to patients to let them know about MyMedicare, the registration forms to print out and have in your practice for those patients that need to fill out the form while in the practice, those are available there. There are posters about MyMedicare that you can order and get sent to your clinic. The brochure, like the one that is on here, is available there. There's some things for social media. There's frequently asked questions for patients and also for practices. And there's how-to videos, how to register patients, how to register for for PROTA and HPOS in the organization register. And then also contact numbers for if you do run into difficulties with any of these things and need assistance troubleshooting, there's lots of direction on there for where to go. So thank you, everyone. And I'm going to turn it over now back to Claudia, who's going to speak about primary sense, meaningful use for your practice.
Thanks so much, Alison. So thus far in Brisbane North region, we have successfully transitioned 240 practices to Primary Sense. Primary Sense is an easy-to-use population health management, clinical decision support, and data extraction tool that helps general practice staff deliver the right care to patients at the right time. And as you can see by this infographic, it has 6 main components, which are data extraction, data analysis, decision assist, care planning, care optimization, and care review, with the patient being at the center of everything with Primary Sense. So why is Primary Sense important to GPs, and what makes Primary Sense different? A key feature is the inbuilt Johns Hopkins risk stratification tool, which gives patients an adjusted clinical group score, which is an ACG score, and it scales from 1 to 5, with 5 being the most complex. So GPs can use Primary Sense to easily identify patients who are at risk of hospitalization and poor health outcomes. So having a look at a whole practice approach, Primary Sense is a clinician-led tool. However, we do encourage your practice towards the whole practice approach to support GPs, nurse practitioners, and practice managers. And if this is something that you'd like to explore further, please don't hesitate to get in touch with us, and one of our QI&D officers can help support you to make Primary Sense more of a practice approach. Primary Sense is evidence-based and works with governing bodies to align with government programs, initiatives, such as the VPR report that we will be going through this evening and the National Clinical Strategy. At the point of care, Primary Sense has medication alerts, prompts, and reports which assist general practice staff to identify patients who are at risk of poor health outcomes, treatment plans for preventative health, and evidence-based interventions such as a vaccination. Primary Sense is easy to use. It provides one-click reports. And lastly, it supports PIP-QI improvement measures with developing CQI action plans, which makes it easier for you to meet your PIP-QI documentation requirements. And now I'll hand over to Jo, who's going to be discussing Primary Sense prompts and alerts.
Thanks, Claudia. Good evening, everyone. I'm Jo. If you haven't met me before, I'm one of the Quality Improvement Engagement Officers at Brisbane North. I'm just going to do a quick dive into one of the benefits of Primary Sense tonight that Claudia just spoke about, and that is prompts and alerts. So what is the benefit of a prompt? If you look at the little cartoon on the screen, it might give you a few little hints. So as you can see, and as you're aware, prompts are on-screen visual support tool that allows clinicians to plan and coordinate care in an effective way. So why is this important, and how does this support you? Prompts highlight potential gaps in care. And then including the use of the Johns Hopkins ACG tool, the prompt displays complexity and hospital risk scores. So how are these scores relevant to you? Well, the complexity levels reflect the current care needs of the patient, while the hospitalisation risk identifies estimated future care needs. While patients with higher levels of complexity are more likely to be hospitalised than those with the lower levels, the complexity is not directly associated with the hospitalisation risk. So many of the primary sense reports therefore include both results. If you take a look on the screen at the red arrow next to the more information within the prompt, clicking on this section provides the rationale for the prompt. And it also displays relevant details for cross-reference for the GP. You can see here on screen, the graph contains the patient's actual clinical results where they're available. And a last additional note on the prompt, selecting an action other than remind me next time, this will disable the prompt for the patient for 12 months. So just moving on to the medication alerts now, and how are the alerts supporting you? Well, the primary sense medication alerts are different to the medical director and the best practice medical alerts. These are more specific and they relate only to high risk medications, and they also take individual patient factors into account. The medication alerts and reports, they don't replace clinical judgment. These alerts rely on your coded data, and they also rely on accurate current medication lists. Also, another important note for the alerts, in the message, clicking on anything but remind me later will switch the alert off for 12 months for the patient and for any other GP prescribing for this patient. So those are just a few key features within the prompts and alerts that will continue to support you in your day-to-day workflow. And I hope that's helped to sort of clarify how this incorporates with the meaningful use of using your prompts and alerts in your day-to-day. I'll now hand you over to Tammy and she'll give you a run through on the reports for the VPR.
Thank you, Jo. I'm Tammy Archdell, and I'm also a Quality Improvement and Development Officer with Brisbane North PHN. Now we're going to talk about primary sense reports. We've discussed the benefits of MyMedicare for your patients and your practice. Primary Sense has a voluntary patient registration report that prioritises patient cohorts, making it easy for you to identify chronic and complex patients who may benefit most from MyMedicare enrolment. It is simple and easy to locate. Open Primary Sense, click on the report tile, click on the voluntary patient registration report as highlighted in yellow on the screen. This is an image at the top of the top section of the voluntary patient registration report. When clicking on the Aqua tabs, they expand to display further information. The voluntary patient registration report highlights patients that are high risk and have fragmented care. To view the information about which patients are included in the report, click on the Aqua headings as per the example shown. The report will allow you to select patients likely to be eligible for MyMedicare. The data used shown on the screen is test data and not of real patient data. This is an example of the report. The table columns can be sorted via the small grey arrows next to the table headings, as you can see on the screen. You can also filter using the search box. The tables can be sorted by date, last visit, booked appointment, visit count, or GP name. The table can be printed, exported to Excel for further sorting, or exported as a CSV file for patient recalls. If this report has sparked your interest, why not open the report tomorrow and look at the data available within the report? Primary Sense can also assist with reports for identifying patient cohorts to support your continuous quality improvement activities. As part of the PIPQI incentive, practices are required to participate in quality improvement activities in partnership with their local PHN. Brisbane North PHN Quality Improvement and Development Team are available to support you. The CQI activities can also assist GPs with CPD hours for mini or full clinical audits. We have a range of resources and toolkits to help you make improvements in your practice. Whatever the improvement activities are, we are able to assist you. Continuous quality improvement. What are we trying to accomplish? Enroll patients in MyMedicare. How will we know the changes is an improvement? This is the measure, 100 patients to register for MyMedicare. What change can we make that will lead to an improvement? Use the Vulnerable Patient Report in Primary Sense to flag patients eligible for MyMedicare enrolment. By doing this, you've created a system change that leads to an improvement and processes in your practice. This is a PDSA template. Brisbane North PHN Quality Improvement and Engagement Team can support you to implement and develop quality improvement activities. Contact us at practicesupport@brisbanenorthphn.org.au for assistance. This is an example of a pre-filled PDSA activity using the Primary Sense Vulnerable Patient Report. The Continuous Quality Improvement Activity. Plan. We aim to register 100 patients for MyMedicare. The do. Was the plan executed? Any issues? Issues. Low patient knowledge of how to enrol in MyMedicare. We upskilled staff on enrolling patients and printed hard copies for patients to complete. The study and results. We registered 95 out of 100 patients. Celebrate all your achievements. Act. What will we take forward from this cycle and our next steps? We're going to continue to enrol patients in MyMedicare. PDSAs can be simple or complex to suit your requirements. Brisbane North PHN have a suite of resources available to support you. And just by doing these simple few steps, you could have just completed CPD hours for measuring outcomes and reviewing performance. By attending tonight's webinar, you've just earned 1 hour towards your CPD education activity time. GPs are required to record 50 hours of CPD across different activity types per year. There are some required activity types, but also flexibility in how you make up the hours. We can assist with however you decide to acquire your CPD hours. This slide shows more detailed information on CPD activities. Our next webinar will be held on the 28th of November at 6 p.m. and we will have Juliet from RACGP speaking on everything you need to know to complete your CPD hours easily. Now I will hand over to Leanne for questions.
Thanks, Tammy. We've got a couple of questions that we can go through here. Just have a quick look. All right, first question is, can Primary Sense identify just your general practice patients yet? We currently use best practice software for all our general practice and allied health and complementary medicine patients. Currently, there's a product enhancement request that's been submitted to Primary Sense to separate or segregate general practice data for those practices who require this feature. However, we do not currently have an ETA for this feature, but hopefully we will have that option down the track. Another question that we've got here is, are prompts available for nurses? Again, this is currently in progress and being developed, but unfortunately we don't have a full ETA on that, but it has been a really popular request. So we're hoping that one will come along really quickly. Do we have templates for the use of PDSAs? As Tammy just mentioned, yes, we do have a suite of tools and templates, and we're constantly developing them and updating them. You can also access the CQI tab in Primary Sense, and there's templates available in there Alternatively, visit our Brisbane North PHN website, and there are some CQI templates to get you started. As Tammy also mentioned, remember to reach out to your practice support or your quality improvement engagement officer, and if you'd like assistance with that QI journey. What have we got next? Is there any online Primary Sense training for GPs and staff? Absolutely, yes. So Primary Sense website, so primarysense.org.au, I believe it is, has recordings, has videos and guides in there. There's also recordings of our previous websites on our PHN website. And you also, of course, have the option of requesting one of us to come out for personal assistance should you need some extra training. Next one, I think we've got 2 left. How do we find out about updates to Primary Sense? Okay, so any updates that are available are via the release notes on the Primary Sense website. And also look out for updates via our regular PHN communications, including our Practice Link and GP Link as they come along. And the last question that I've got here is, does Medical Director have patient registration templates? Yes. So just recently, some of the softwares, including Medical Director and BP, have updated their templates to include a MyMedicare patient registration form. So you can use those for your DVA patients and any other patients that would prefer to use a paper registration form. But that's all the questions that we've got there, Claudia. So I think back over to you.
Leanne? So as Tammy did mention, please stay tuned because we are hosting another webinar in 2 weeks. So it's on the 28th of November. And it will be the same time, so 6 to 7 p.m. And it's really exciting because we have had a lot of feedback from general practices that they have questions in and around how to achieve their CPD points and the differences between certain aspects of CPD as well. So we have asked one of the representatives, Juliet from RACGP, and she will be outlining all things CPD, and she'll be here to answer any on all of your questions. So she'll be going through the different components and how to actually achieve your CPD points. We'll also be highlighting the different ways that Primary Sense can aid with your CPD as well. So a little bit of an early mark tonight. Thank you so much for joining us for tonight's webinar highlighting Primary Sense and how we can use the My Patient registration form for MyMedicare. Thank you so much for your engagement and for your questions on this very fast moving and emerging space in healthcare. Once this webinar has finished, we encourage you to fill out the evaluation form for this webinar, which will help us plan and improve education webinar events that we will host in the future, just like this one. Our slides will be sent out with an FAQ and resources that have been discussed tonight, along with your certificate of attendance for your quick log of CPD points. And as I said in the housekeeping, please note that this will take up to 2 weeks to be sent out. And lastly, if you require any further support, more information, please don't hesitate to get in touch with our practice support, and the details of how to get in touch will be sent out with the post-webinar resources. Thank you so much for joining us, and I hope you have a wonderful evening.